Busy call with the White House, which are important for me to be on, so I apologize for keeping you. And I want to thank you, as I always do, by continuing to tune in to these press conferences. I'll be back tomorrow at 1 o'clock, Friday at 1 o'clock, and then starting next week, we'll be just going to Monday, Wednesday, and Friday at 1 o'clock. I will say there's a good bit of news coming up in the next few days and next week. As it relates to what comes next, as it relates to different supports that we'll be providing. So I would encourage you all, if you can, to continue to tune in and also continue to check out reopeningri.com. So we'll begin, as we always do, with the data on the screen. It's, again, another encouraging picture. In recent days, every day we put the data up, and it's an encouraging picture. We continue to see a positivity rate below 5%, which is excellent. You know, our testing is increasing, still testing thousands of people a day, which is a good thing. And the test positive rate is below 5% statewide. The test positive rate in certain communities is still too high, and we're working hard on that. We are laser focused on getting into these most vulnerable communities, parts of Central Falls, parts of North Providence, parts of Pawtucket, parts of Providence, where we have to do better. We have to get that test positive rate to below 10%. We're not there yet. We're laser focused on it, but statewide, less than 5%, it's a good picture. Today we have 107 new cases, and very sadly, again, another 10 deaths. And I would ask all of you, just continue to remember that we continue to lose loved ones every single day to this virus. So even as we move into phase 2 and we have a good handle on it, be vigilant and bear in mind the real suffering that is happening all around us in the state of Rhode Island. Speaking of suffering, it's not only healthcare suffering, there's a lot of economic suffering, and that I'm aware of that. And I wanted to talk a little bit about the deficit that we are probably facing as a state, and particularly we are facing as a state, and particularly about how we plan to begin to address that deficit with our state workforce. As I've said in the past, the deficit that the state is currently projecting is bigger than anything we've seen before, unprecedented really. And if we were to have to close that deficit without additional federal aid, it will be devastating. There will undoubtedly be layoffs and furloughs extensively. We will see cuts to aid to cities and towns, aid to our healthcare system, massive and wholesale restructuring of the way we deliver government services, which is why at the moment I am more focused on continuing to work with our federal delegation, with my fellow governors all around the country, with the White House, with the Congress, pushing for more congressional aid, more federal aid. The deficit in Rhode Island projects to be about $800 million. It's very hard to see how we could close that gap without additional federal stimulus. So the approach I've taken, which we've talked about here, is all signs suggest that Congress is poised to pass another stimulus act. Our federal delegation is fantastic and working very hard on it. I hope that we will have information about whether that happens and the size of that by the end of this month. And then once we have that, we can really get to work balancing the budget. Having said that, in the meantime, it's important that we take as many steps as necessary or as practical in order to keep our costs down. I have said throughout this that letting go of and furloughing state workers in the middle of an economic crisis is something that I was loath to do. I am loath to do. The last thing I want to do is add to our unemployment insurance ranks. So I asked Director Smiley to work with the state employees and their unions to figure out ways to immediately cut cost, but to do it in a way which was humane and delayed layoffs and furloughs, at least until I have a better sense of exactly what kind of additional federal aid will be coming in. I'm very pleased to say that after a lot of work, including throughout this weekend, the Department of Administration announced, I think this morning, that we have come to agreement. We plan to leverage the federal WorkShare program for state employees. The federal WorkShare program uses federal funding from the CARES Act to help us reduce personnel costs, but while minimizing the economic impact to individual employees of the state. It's a voluntary program, but I am encouraging as many eligible employees to participate as possible, because that will enable us to maximize our savings. If you have any questions, members of the press, we can go through the details with Director Smiley. What I'm also saying, and I'm asking that other branches of government, not just the executive branch, consider leveraging the WorkShare program to cut their costs immediately. I'm strongly encouraging them to participate. The deficit is a statewide problem, not just an executive branch problem. So I'm asking the other branches of government, I'm asking the general officers, and strongly encouraging you to look into this initiative. It is a way that you can save millions of taxpayer dollars quickly, but while also avoiding layoffs and furloughs and particular economic hardship for our public employees, until we have more information about whether we're going to get additional federal stimulus. I want to, in addition to thanking my own team, particularly Director Smiley, I want to thank the state employees. First of all, I want to thank you for your service. You haven't stopped working through all of this. Some of you have incredibly difficult jobs on the front lines of this. Many of you are working weekends, et cetera. I want to thank you for that service on behalf of the people of Rhode Island. I want to thank you and your leadership for coming to the table over the weekend to come to this agreement. It will enable us to save money in the time that we get some clarity around the stimulus from the federal government. And I would like to strongly encourage all state employees, public employees, to sign up and take advantage of the WorkShare program to do your part to help us manage through these very difficult times with a very difficult, large state deficit. Okay, a few more announcements. I want to shift gears slightly from that and talk for a minute about contact tracing and the Crush COVID RI app, which supports contact tracing. I will say that as I've been up here in the past week really pushing use of the app, we're getting a lot more questions. And they're very fair questions, right? Like, will you have access to my data? I hear you, Governor, you want me to do this. I want to do the right thing, but I'm nervous about it. What is it exactly? So I'd like to just take a minute to explain what it is, what it isn't, why it matters, and why I continue to ask you to download the Crush COVID RI app and also maintain your contact tracing notebook. I think if I explain it, and it makes sense to you, you'll be more likely to opt in. So the number one thing you need to know is the Crush COVID RI app is and always will be optional. Optional at all times. Your choice to download it, your choice to use it, and your choice to get rid of it if you decide at any point you don't want to participate. You can use the app with or without the location diary. So at this point, I think we have about 45,000 people who've downloaded the app. I'd like to get that number higher. So if what you're nervous about is this location tracker, then just download the app, but don't enable the location tracker. Maybe you could just do the symptom tracking. Maybe you could just use it to keep yourself informed. Maybe you could use it to find where you could get a test. But please, I'm asking you to consider opting in. When we started to create the app, I told the team privacy was my #1 goal. It had to work. I said privacy and data protection was my #1 goal. It's important to me, it's important to the people of Rhode Island, and I want you to have confidence that no one's going to get a hold of your data. This is what I would like you to have confidence about. Why should you have confidence about? The app does not collect and will never collect any identifiable information. It will never ask for your name. It will never ask for your birthday. It will never ask for your address. It will never ask for any identifying information about you. So whatever data is there will never be stored in a place where it's associated with you, your name, your address, your birthday. Another point I want to hammer home, because we're getting it constantly, this has nothing to do with your contacts in your phone. So most of us have a smartphone, and in there we have our contacts. And people are saying to me, Governor, I don't want anyone to have access to my contacts. So I guess it's confusing because we use the word contact tracing. I want to try to be crystal clear about this point. This has nothing to do with your contacts in your phone. It has nothing to do with that. No one's ever going to access that. We can never get a hold of that. We can never see that. Frankly, I have downloaded the Crush COVID RI app. I don't want anyone seeing or having access to my contacts or my family's contacts. So I hope I can give you some clarity. Although we call this contact tracing, it has nothing to do with the contacts in your phone or any contact information of your friends that you have stored in your phone. If you use the location diary, first of all, you have to turn it on. You can turn it on and you can turn it off. It just tracks where you have been, the locations where you have been. So, but it will not track the people who you have been in contact with. And that is the reason why I'm asking you to continue using your contact tracing notebook to write down the names of the people who you've had access to. So here's how it would work. Let's say you test positive. You will get a call from the Department of Health. They will ask you, have you turned on your location diary? Hopefully you say yes. Then they will ask you, would you be willing to transmit that location diary to the Department of Health? You could say yes, you could say no. If you say no, they'll ask you to read to them. They'll ask you, where have you been in the past 10 days? And you can read from your phone the addresses where you've been. By the way, it's very helpful. You might not remember today that you went to CVS 10 days ago. You might not remember today that you stopped by to visit a friend or see your mother or went to the grocery store 10 days ago. So it will jog your memory. You might not remember what you did 3 days ago. So especially now at this time that we're all so busy and anxiety is high. If you say yes, then it will transmit the list of locations that you've been to without attaching that list to your name to the Department of Health. At that point in time, someone from the Department of Health will go through a very extensive interview with you. It is a painstaking interview, which is why we have over 100 people working full-time right now, many of whom the National Guard, doing nothing but what we're calling contact tracing. They will ask you, okay, you were at your house yesterday, who were you in contact with? And we want you to be able to say, my mother, my sister, my boss, my coworker, and then we're going to reach out to those people and tell them that they have been in contact with someone who's tested positive. And then they can take action. If those people are already sick, they'll be in isolation. If not sick and they were in close proximity to you, they'll be quarantined. We probably recommend that they get tested, certainly if they have symptoms. So it is this is a laborious process, and a lot of people have asked me, like, why I talk about it so much. But the contact tracing is about as important as anything we're going to do, because it will allow us to catch outbreaks before they happen, and it will allow us to prevent widespread community spread as we begin to reopen this economy. So I hope that is helpful. I hope I've cleared up some of the confusion. And for those of you who were still reluctant to give Crush COVID-RI a try, I'm asking you again to try it. We are doing all kinds of things we never thought we would do. We are wearing our masks. That's a little bit strange, but it is working. We're keeping 6 feet away. We're not shaking hands of people. We are working from home. I know this is just another thing I'm asking you to do. Keep a notebook of the people you've been with, and please consider downloading the location diary on the Crush COVID-RI app. I promise you this is going to save lives. I promise you this will save lives, particularly as we go through the summer, as we reopen the economy, as we get schools back open, as we get to living our life as quote-unquote normal, and we're all going to be interacting with more people. My ability to allow us to do that, keep people safe and reduce outbreaks, depends completely on us having contact tracing and testing. Trace, figure out who's been exposed, test them, get them into isolation, and keep a lid on this virus so it never comes raging back. Also, we continue to hear it's a little bit difficult to use on the Android phones. Some old phones it doesn't work with. I hear you, we're working on it, and we're going to have another iteration soon, like the next version will be coming out soon. So if you keep using it, tell us what you don't like, and we're going to do our best, and in a few weeks we'll have a new version, a new release. A couple more points. I think, protests are on all of our minds now as we as a nation see protests all over the country. And yesterday I was asked by one of the members of the press if Dr. Alexander Scott and I are concerned that the protests we're seeing in Rhode Island could cause an outbreak. And the answer is yes. I'll speak for myself. I am concerned, and I know the doctor is concerned as well. This, again, is a difficult situation. It's a fundamental democratic right in our society, First Amendment right, to protest, particularly when we see things that are unjust, wrong, unconstitutional, and we have a need, arguably an obligation, to speak out against that injustice. And so that's why I feel that these protests should be allowed to occur, as has been happening actually for different causes throughout the crisis, the COVID crisis, so that people can participate in democracy and advocate for change. Having said that, it doesn't mean that we can forget that the virus is still with us and that we still have to do everything that we can do in order to keep ourselves safe, keep our families safe, and prevent a future outbreak. So to that end, we have been spending a lot of time recently trying to figure out what actions we could take to both enable safe protests, which are so vital, and also do our best to keep everybody safe and prevent an outbreak. So the following are some things that we're doing and will be doing. Going forward, we will have Rhode Island Department of Health staff present in good numbers at peaceful protests to provide information and resources to protesters. Could be a flyer, could be verbally sharing information. The virus is ever present. The virus doesn't sleep, it's not going away. So we have to be ever vigilant. So we're going to have members of the Department of Health, probably in a t-shirt, identifying themselves as Rhode staff, providing information about the virus. They'll also be distributing masks. I would ask you, if you're going to go to one of the outdoor protests, to bring your own mask, but let's say you forget, whatever, you lose it, our team will be distributing masks. Our team will be reminding you to keep social distance, reminding you that the social gathering limit is 15. We don't want you coming and congregating in big crowds. Obviously, it's much safer outdoors than indoors, but do your best to make your voices heard, which is vital, but keep a distance from those around you and don't show up, please, in a big crowd. And the Department of Health will be gently encouraging you and nudging you to keep that distance. We're going to be encouraging you, they will be encouraging you to download the Crush COVID RI app. They're going to be reminding you to keep a list of your contacts. If you do go to the protest, if you see who you're going to be near, jot down who they are, jot down the friends you went with, jot down the names of the family who you were with, so that if 2 or 3 weeks from now we have a problem, we're going to call you, we're going to ask you where you were and who was in your circle. We're also going to be they will be providing critical information about symptom monitoring and information about how you could get tested. Because if you go to one of these events and then you come down with symptoms, we want you to go ahead and get tested. And so we're going to be giving you that information at the protest around where you can be tested, what symptoms to look out for. Now, I do want to make a very important point, and I'll do it as delicately as I can. But it's a very important point. After living with this deadly virus for 3 months, we've learned a lot about it. And we know that the virus is very dangerous for people who have an underlying health condition and who are older and who are frail. So, although I will never tell you to not protest and not exercise your rights and not properly advocate for change, I am going to tell you this. If you live with someone who is older, who has an underlying health condition, who is sick, who has a chronic health condition, and you go to one of these protests and you're going to be around a lot of people, I am begging you to exercise extreme caution out of concern for the loved one you have at home who could get very, very sick or worse if they get the virus. So if you're a young person and you say, oh, COVID doesn't affect young people too badly, that may be so. But if you work with someone who's older, if you live with your grandma, grandpa, mother, father, aunt, uncle, if you're hanging out with your neighbor who has diabetes or who has asthma, you have to know, I'm asking you to please be careful so you don't spread your virus to them and they wind up in the hospital or even worse. So just please accept that advice with the spirit in which it's intended to keep everybody safe and prevent any more loss of life on account of the COVID-19 epidemic.